program.
Yeah, I can only apologise, everyone. We've kind of been battling the clock most of the time, I think, and I'm so sorry for the rush. So these are just a few thoughts on motivational strategies from a MOHO perspective, or maybe not just MOHO perspective actually, but certainly anchored in MOHO. So whenever you've got an engagement issue, whenever you sense that you're just not quite on the same page as a service user, I think always come back to personal causation, values, and interest to help you try and understand and figure out where the disconnect is, what's driving the choices that they're making to not engage with you, what's more important to them than what you're offering, and just try and retune yourself into their view of the world. Time spent in really trying to understand someone's volition is really time very well spent. In terms of other principles, again, this is obvious, and I'm sure that you're all doing it, but you cannot underestimate the value of just good old-fashioned rapport building, building relationship, building trust. And sometimes that can't be rushed. Some services don't allow for too much of that. But even in a frantic acute environment, just 2 minutes sitting down next to a patient on their own in a lounge, just for a very quick catch up, that's all about building connection. And I think that is so vital for engagement and motivation, having a relationship of trust as a foundation. Again, obvious, but encouragement, that comes up a lot in the MOHO master table there, just good old fashioned encouragement, noticing good things, noticing small successes, feeding that back. Advice and signposting. So advice is a bit out of vogue, in this client-centered world, but advice and nudging and signposting does have a place with the right person at the right time. Environmental enrichment. So it just some of the things that Sean was kind of touching on a bit in terms of it with the Reese there. So introducing valued activity equipment or resources into the living space, so that there are just more opportunities, things on hand if the mood strikes. Social support to overcome first hurdles. So doing with, going with, to give people the kickstart to get moving with some things. Then, of course, identifying and re-engaging with interests. So the interest checklist is obviously a really helpful tool just for trying to identify sparks of interest. And then again, obvious stuff, but goal setting small achievable goals, and activity scheduling, thinking about timetabling and setting those sorts of things in a small scale way, breaking things down, good old-fashioned OT stuff. One of the hidden gems of assessments that a lot of people don't know about is the occupational questionnaire, which is a really nice tool for helping people to map out their week and then describe how they feel about those different activities. Which of those activities are they enjoying and finding rewarding, and which of those are they not? So that's a really nice tool to familiarise yourself if you don't know it yet. And then just to keep Mandy happy, but no, not just to keep Mandy happy, I think it's absolutely valid that it might not be motivation. If someone, is it that the person is unmotivated, or are they just disconnected, disengaged due to a sensory processing issue? So we want to kind of hold that recent training in our minds as well and think, let's not forget the sensory component. Right, so remotivation process. Obviously, we can't talk about motivation without talking about the remotivation process. We've got a lot of information on this in the main workbook. So if you want to find out more about this, that's the place to go. But the remotivation process is a progressive intervention strategy, very structured intervention strategy designed to enhance motivation in people with very severely impaired motivation. So, and the main thing that you're doing with the remotivation process is enriching the environment, modifying the environment to make it more motivating, a more fertile environment for motivation to thrive. The assessment process involves building up a picture, this is where the occupational performance history interview might be helpful with a family member, trying to build up a life history of how has this person become so unmotivated? What's been the story that's brought them to this point? And as part of that story, you might identify times in their life where they were more motivated, and that might give you some keys to unlock for the present. The volitional questionnaire, another one of the tools that we've not had time to look at today, but the idea with that is that's an observational tool where you're looking for, and that connects with one of the other tools we've been thinking about, the Explore today. There's a lot of volitional stuff in the MOHO Explore actually. So you're observing the person in an environment and you're looking for signs of motivation, signs of curiosity, and you observe the person in a number of different environments and you try and see what type of environments bring out the best in them. And then the intervention process is very structured, involves a lot of rapport building and gradually introducing meaningful objects into their space to try and respark motivation. And then just a quick nod to some of the more generic motivational approaches. So things like solution-focused brief therapy has some really helpful, very quick to learn principles around motivation. Motivational interview, and some of you will have done training in, and then the trans-theoretical stages of change, I think certainly was used a lot in eating disorders, or where you've got people in very entrenched cycles of behaviour and you're trying to think about what stage are they at in the change process and modifying your interventions accordingly. Right, I think we are done. We're going to do one really quick breakout, not surprisingly. If those of you need to go sharpish at 12, just go when you need to go. For those of you that don't mind just hanging around for 5 more minutes, or maybe 10 more, we might go to 10 past 12 in this final breakout group, just to give you a bit of time for those that can stay. We're just going to be asking you to do 2 things. One is to think about any reflections from this morning, anything that's particularly lodged with you, anything that you particularly think, I want to look into that further, and kind of some constructive actions I want to take on the back of what I've heard. And then you're going to get a separate link in the chat. Is that right, Joe, for the feedback?
Oh, David, I haven't. Do you want a feedback in the chat? I can
if you don't mind, yes. So okay. Is that going to be straightforward to do?
Yeah, I can do that now.
So, but can people access the chat from the breakout?
No.
Oh, okay. No, put them both. In that case, put them both in the normal way. But then people won't be able to put the feedback in, will they?
Sally, if you put the link into the chat now, I'll copy it across and I'll enter all the breakout rooms.
And I wondered whether there was something about people reflecting in their own groups, and then a feedback is about the training as a whole.
It is.
Yeah.
I suppose I'm just trying to kill 2 birds.
Okay.
So yeah, go into your groups and we'll sort it out. Thanks.
I'll press that now.